Well, good morning, everyone. How are you? Welcome once again to another live this morning. Hope you're having a great start to your day. We appreciate you guys more than you know. More than you know. And without you, this is not possible. And Brahim and Michael, 1 and 2 on the hit parade this morning. Surprise, surprise. Surprise, surprise. Andrea, you guys, you make up the Trinity. You come up 1, 2, 3 almost every morning, and we thank you guys. Hey, Janice from Brampton. Welcome, welcome, welcome. There's Kevin from Oshawa. Dear friends of this program, Chantal, how are you? Carol, West Virginia. Fran, Orangeville. And was that Nina from Chatham? And, now they're going into my cloud real fast. John. Elgin, Illinois. Diane, Thunder Bay. Come on back up, guys, if you want me to say hello. Nick from our staff. Carrie, Nebraska. Lori from Alberta, how are you? Georgie, Halifax, Nova Scotia. Jeanette, how are you? Rosemary, Moncton. And I don't know, can't see it. Nina, how are you? Judy. And Jeanette, and Deb from Motown, and Nancy, Gore's Landing. Rose, how are you? And April, good morning to you. And Frances Marie, how are you? Wanda from Virginia. Donna, saying hello to Elaine. How about me? Heather, Miramichi, Mira whatever you call it. Dave, Fran. Fran's in the hospital, guys. Give us more details, Fran. Sandy, Fergus Falls, Minnesota. Adeline. Donna, we love those Donnas. Rosa, Montreal. And Sandra from Aurelia, good morning. Marianne, New York. Ornella, how are you? Enjoying coffee. And Bonnie, Judy, Elaine, and a couple of more. There's Doc McEwen. I can finally see you, Doc. I don't know what's happening. Verna and Veronica and Cheryl and Francis from Vaughan and Maryland, Lisa Marie, and Heidi, and Gloria, New York. Eric, hello. How are you, my friend? Milika. She said I missed her again. Bonnie, I tell you guys, Sharon, Michigan in her motorhome. Hi, wow, Maria. And Rosa Linda, guess she's up in the cloud. Yep. Nellie, how are you? And you see, Dave and Aurora, how are you? Elaine, Donna, Park Hill, and Muriel, how are you? Tina, we love having you on. Faye, good morning. Sue, Manitoulin Island, God's country. Nicole, Magog, Quebec, bonjour. Joan, Shona, and see, I missed one. Goes up in the clouds, guys. Sherry is saying we're praying for Fran. Yeah, we sure are. Gail, Leila, and Dave, and Maureen. And guys, I just mentioned Yolande, because we haven't mentioned her name in a while, but she's in a rehab center, okay? Pray for her, think of her, one of our dear followers, one of my first patients ever. Was Yolande. Okay, a dear friend of the Martin Clinic, and the doctor is in podcast. So remember her. Bruno, how are you? Okay, let's go back to yesterday. Okay, and the reason I want to do it, I want to answer a few questions that folks had. Okay, Renee asked this question. It was an excellent question. I'm glad you asked it. And then a couple of others yesterday afterwards, as I was scrolling, looking at the scroll after the podcast, a few people had this question. Well, here's the question. I really like it. Guys, what do we encourage in this program? Ask questions. I love it. You're thinking. Okay? I always give you guys credit because there's no audience like you. If I ask you a question, you know the answer. You're asking me a question, and I like that because sometimes I'm not thinking about it during the program, and you're reminding me, and this was a good question. It goes, Dr. Martin, why, if, okay, we talked about estrogen levels in women, and this could be men too, but in women, obviously, when perimenopausal or fully menopausal, estrogen levels go down. Is that true? Yes, they do. Well, why is it that if there's so many xenoestrogens around, why doesn't that, why would you say, estrogens are going down and yet we're surrounded by all these xenoestrogens? What a beautiful question. And the thing is, you have to understand this about xenoestrogens, okay? So, in cosmetics, in plastics, in perfume, in deodorant, in hairspray, in air freshener, not all of them, but most of them. Nail polish. Ladies, do you ever use that? Well, most of them are full of xenoestrogens. Perfume and things like that. They're in our homes. They're in everything. Plastic is in everything. 1.5 credit cards a week on average gets into our system, and they mimic estrogen. They're called xenoestrogens. They look like estrogen to your body. Now, the problem, I'm not saying it's a problem, but the very good question was, if we have so much xenoestrogens inside of us, why wouldn't that elevate our estrogen blood levels? Because, guys, it's not estrogen. It's not estrogen. They're xenoestrogens. They mimic estrogen. So if you take an estrogen blood test and you're in perimenopause or whatever, you're going to get sort of a false reading. You're going to see that your estrogen levels are coming down, ladies. Yeah. But xenoestrogens are still there, and they mimic estrogen. You can't measure it in terms of your estrogen levels in your blood. Now, I showed you something yesterday, and unfortunately, this is not prevalent to get this test done. You can actually see the effect of xenoestrogens on your body. Okay? And I used to do this scan. I showed you yesterday. And I am going to take it out again today. Where did I put it? There it is. Okay. Now these scans, okay, they're part of thermography, but they're a very specific test of thermography. Looking at xenoestrogens. I'm doing this, guys, to show you. Okay. Now, if you're on a podcast, you have to visualize this. Okay? I'm showing a woman here that I tested. This is years ago in my clinic, and you can see the leper spots, okay, on the body. Okay? That's estrogen and xenoestrogens. It'll show up on your skin. You can't test it in your blood. But that's why I'm so big on blocking extra estrogen. Okay? I am huge on blocking extra estrogen. Yesterday we were talking about breast cancer. Major, major problem in our society. We're not winning the war on breast cancer, ladies. And I'm not saying it's the only reason, but it's one of the reasons, is we got estrogen. Ladies and gentlemen, you have estrogen or xenoestrogens coming out your ears. Your body thinks it's estrogen. Now, estrogen is a beautiful thing. It makes a woman a woman. It's a woman's hormone. Beautiful. It's beautiful when it's in control. If you would have told me back in the 1970s, when I graduated, that we would have trouble with something called xenoestrogens, what are you talking about? But their chemicals have taken over. Pesticides and herbicides, and they're in the food. They're in our homes. They're in our kitchen. They're in our sprays. They're in everything. You can't run away from plastic, guys. Okay? It's one of the things. You just can't run away from it. Where are you going to go? I've told you the story where a lady came into my office, true story. She said, I'm leaving on a jet plane and I don't know when I'm coming back again. No, that's a song. She didn't say that. You know what she said? She said, I'm moving to Costa Rica. I'm leaving. I'm never coming back. And she looked at me for approval. Like she said, Dr. Martin, I'm leaving. I said, where are you going? Costa Rica. Okay. Why? Because it's pristine there. There's no chemicals there. There's no plastic there. I said, you want to bet? It's everywhere. It's in our oceans. It's in our food supply. It's in our water supply. It's on Mount Everest. It's in the placenta of babies. Everywhere. You can't escape. You just can't. Okay? And I'm not a negative guy, guys. You know me. I'm a very positive guy. But I was negative on going to Costa Rica. I said, well, it sucks to be the rest of us. I said, how can you? No, but really, you're going to Costa Rica. Hallelujah. Nah, come on. You think there's no plastic in Costa Rica? In the oceans there? It's everywhere. Anyway, she wasn't happy with my response. I said, well, if your address ends with planet Earth, you're in trouble. It's the way it is. You ain't changing it. Okay? The world and the elites, they're worried about the climate. I'm more worried about the environment. And you better take measures yourself. Okay? And that's what we're going to talk about today. Because it's one of the biggest factors in breast cancer, ladies. And men, it's one of the biggest factors in prostate cancer. 1 out of 4 men after the age of 50 will get prostate cancer. Worse today than ever. And this is one of the big reasons. One of the big reasons. We talked about it again, not only yesterday, but we're always talking about it. We mentioned, because the headline really was, if you have low levels of vitamin D, you are at much more risk of developing breast cancer. Men, prostate cancer and vitamin D. And what does the world tell us to do? Get out of the sun. Do you know that dermatologists in the 1980s, I'm telling you, they hired a huge marketing firm to scare us about skin cancer. And the rest is history. The rest is history. People are walking around like Casper the ghost. They're so scared of the sun. I was talking to some folks from India yesterday. Okay? And they live in Canada now. And we were just having a nice little chat. And I said to them, you know, you need more sun than I do. And they looked at me like I had two heads. What? Well, you have dark skin. And because of that, you need more sun than I do. I need the sun, but you need it more than me because you have a protective layer. And you need to take in more sunlight than me. They were, what? I never heard that. We were told to stay out of the sun because it causes cancer. You see? Marketing. Marketing 101. The dermatologist could give us a lecture on marketing. How to win friends and influence people. They did it. They scared the living life out of my parents and that generation. The sun. Put on sunscreen. Put on the worst thing. There's a xenoestrogen. Sunscreen. Okay. So yesterday, the question, did I answer it yet? Why can we not measure this extra estrogen in our bodies if, Dr. Martin, what you say is true about xenoestrogens? Well, the answer is because it's not really estrogen, it mimics estrogen. It's a growth hormone. Ain't good. Look, estrogen's on your side till it's not. Because if you have too much xenoestrogens, you're in trouble. You're in trouble. And men, it'll kill your T like big time. We live in a world today where there's very few men left on the planet. Testosterone rates are going down so fast. It's unbelievable. I never thought I would see it in my lifetime where men, I ain't men anymore. Like, as far as their hormones, it's incredible. It's a disaster for health, by the way, because testosterone, okay? So a man is exposed to all those xenoestrogens, okay? And his testosterone levels go down. Oh, okay. What does that mean? Well, that has a big effect on testosterone in a man is essential. Not only for, could men think, testosterone strength. Yeah, it's part of it. But it's way more than that. Because even a man that has low levels of testosterone, their risk of having a heart attack, it goes through the roof. It's over 50%. Diabetes goes up when testosterone goes down in a man. We already talked about prostate cancer. Estrogen is a growth hormone. And when they measure men today after the age of 50, I'm not kidding you guys. Men on average have more estrogen than women have after the age of 50. It's a serious issue in men. Even for a man's brain, you need testosterone. Heart testosterone in a man, not in a woman. In women, you need balance. It's not just estrogen. You need estrogen, ladies. You do. But it has to be balanced with progesterone. Okay, that's all the bad news. Now let's talk about what we should do. Okay? How does one protect themselves from breast cancer and prostate cancer? How do you do that? Let's get real here this morning and give some solutions. What do you do, Doc? We live in a crazy world. Yep. Go to Costa Rica? That's not the answer. Okay? I'm moving to Costa Rica. Nope. That's not on my top 5. If you go there, you might be a little less stressed. Okay? Maybe. But come on, let's be real here. Numero uno. Elevate your vitamin D levels. Okay? And I'll give you numbers. You don't want to be under 60 ngml in the United States. And in Canada, 150 to 200 and up. NMOL-L. Okay? I'll give you numbers. Get my book, Sun, Steak, and Steel. I give numbers for all the blood tests. There's a whole section in here. Sun, Steak, and Steel. Okay? Chapter 8, I think. Chapter 8. Hold on. Maybe it's chapter 7. I don't remember. Where's my blood test? Hold on. Maybe it's chapter 9. Come on. I wrote this book. No, those are the Proverbs. I don't know. Where did oh, here there is chapter 10. Sorry. In chapter 10, I talk about thyroid testing, HDL, triglycerides, uric acid. Okay? Why you want all those tests? Liver enzymes. You get those basic metabolic tests done and you'll have the answer to where you're at in terms of your health. Vitamin D. Important to know where your vitamin D levels are. If you can get that done, and if you can't, I saw the scrolls yesterday on people getting their vitamin D levels done. And it was like pulling teeth for most people. Like you had to bring your physician to the dentist and have their teeth pulled without anesthetic in order to get them to order a vitamin D test, because they don't read. They don't study. They still see vitamin D as an ancient, oh, that's that quack, Dr. Martin, talking about vitamin D. Man, if the truth be told, vitamin D is the most important vitamin. Sun. And then you have another vitamin, vitamin S, steak. And then you have a vitamin E, the real vitamin E, exercise, steel. Okay, so what do we do? Vitamin D. And I know people, they supplement all year round. Okay? They get in the sun, but they still supplement. And again, I used to like to measure, but even without measurement, like, guys, if you go in the sun for 20 minutes, okay, no sunscreen, 20 minutes, you get 10,000 IUs. How can 10,000 IUs be dangerous? It's crazy. The math on vitamin D is crazy. They missed the boat. They scared everyone. You got too much vitamin D. I actually saw something again yesterday. Too much vitamin D, you're going to have a heart attack. It'll calcify your blood vessels. It's just the opposite of that. Do you know that vitamin D is one of the greatest anti-inflammatories that you can take? Guys, be honest for a second. Go out in the sun. Feel better? The sun's out. Feel better? From your brain to your toes, you are a human solar panel. Okay? I'm not telling you to buy an electric vehicle, but I'm telling you, you are an electric vehicle. Your body runs by the sun. And if you can't get the sun, well, you better be eating blubber to get vitamin D. Okay? That's what the the Inuit did. They did it. I don't know what they do today, but they used to. Prove it. They had high levels of vitamin D, and they never saw the sun. But they ate vitamin D. And one thing about vitamin D, you have to eat it every day. It's in fat, because it's a fat-soluble vitamin. And vitamin D, by the way, is only found in the animal kingdom when you want to eat it. Eggs, meat, and cheese. Why do you think I talk about that all the time? Okay? Now, what else do we do? Okay? Really important. Dim out your estrogen. Ladies and gentlemen, dim it out. Flax seeds are the only seed on the planet with high levels of lignans, and lignans block estrogen, extra estrogen. They're not going to take away all the estrogen that you need. It takes away those xenoestrogens that you don't need. That's why I like flax seeds. Okay? I'm not big on seeds. Nuts and seeds, I'm not big on them. You're not a squirrel. Okay? I'm not big on them. But I like flax seeds. And guys, you know me. I've been saying this for eons of years. Okay? And our menopausal formula has DIM in it. D-I-M. Blocks it. It blocks those xenoestrogens. Vitamin D, essential. Block those xenoestrogens as much as you can. Okay? As much as you can. Block those xenoestrogens. Lower your insulin. Because insulin is a growth hormone. Just like estrogen is. It's a growth hormone. And you want to lower your estrogen levels. Very important in cancer. Because cancer needs to, what? Cancer cells need to, what? Grow. And they love sugar. They love crappy carbohydrates that turn to sugar rapidly. Let's lower that. You can't go wrong by lowering your sugar intake, especially high fructose corn syrup, which is in everything. Okay? Lower that. Lower your insulin, lower your estrogen, up your levels of vitamin D, lower your cortisol, because cortisol is pouring gasoline on the fire. Stress. We live in a stressful world today. Big time. I did a podcast I was interviewed on another podcast the other day, and I said, one of the biggest changes in my practice, this is years ago, 20 years ago, I said, was the levels of cortisol. See, I used to measure cortisol. I said it was like almost every patient had high levels of cortisol, and that wasn't always the case. Why? Well, we live in look, your body doesn't know whether you're being chased by a tiger or you're surrounded by xenoestrogens. That stresses your body. It elevates your cortisol. What does cortisol do? And it elevates your blood sugar. It elevates your blood pressure. It elevates inflammation. And whenever I did a case history on a cancer patient, breast cancer patient, case history, here's me. Tell me what traumatic event you've had in your life in the last 5 years or so. What? Doc? What are you asking me? What traumatic? Divorce? Separation? Loss of a loved one? Care for an aged parent? A child in trouble? Family dynamics? I said, tell me what traumatic event you've been through in the last 5 years. Because cancer takes 5 years to grow to the size of a tip of a ballpoint pen. I said, tell me what happened in your life. And boy, did I ever get the stories. Yeah, wasn't easy. Yeah. It was a perfect storm. Cancer needs a perfect storm. Stress. And low levels of vitamin D. And xenoestrogens coming out the wazoo. And usually, when you're stressed, comfort foods, and you become a carboholic. And then the world out there tells you, well, don't eat so much meat and don't eat, eggs and cholesterol. And they're on a cholesterol insanity. It's cholesterol derangement syndrome. I like that. Cholesterol derangement syndrome. We live in an insane world because that's all they want to do. Lower your cholesterol. Yeah, if you want to die young, lower your cholesterol. You'll die young. But you'll lower your cholesterol. Even for cancer. Don't get me started. Stay away from those oxalates. We talked about that. The green. Everything's got to be green. like green juice. And I'm eating greens. Okay. You ain't a rabbit, and you're certainly not a cow. And you live on sand. And you got oxalates, and whenever they analyze breast tissue that's cancerous, there's a lot of oxalates present. Again, buying the lies that the animal kingdom is not the food to eat. A little bit. Drives me crazy. Okay. Keep your liver clean for cancer. Keep your liver clean. How do you keep your liver clean? Lay off the carbs. Sugars will gum up your liver quickly because sugar turns to glycogen stored as fat in your liver. Empty the liver. That's why I love the reset. In 6 days, you can empty your liver. Maybe even quicker than that. It happens so fast when you lay off the stinking carbohydrates. Take probiotics. Probiotics are one of the best defenses against xenoestrogens. Did you know that? Yeah? There's certain strains. And I used to prove it again with these before and after scans. Probiotics are very helpful. Broad spectrum probiotics. You need that. Everybody needs it. Your dog needs it. People ask me that all the time. Can I give a probiotic to my dog? Yeah. Okay. I'm not a veterinarian, but no, but everybody needs probiotics today. We live in a chemical crazed, infused world. It's the way we live. Oh, I better start breathing here. My blood pressure went up. My blood pressure went up. Okay, guys. Hey, you know what tomorrow is? Question and answer Friday. Send your questions in. I love when you ask questions, guys. I want to answer questions. I really, really do. Okay? Okay, I'm breathing. Guys, we love you so dearly. Hey, guys, on Facebook, we're up to 84,000 followers on Facebook. That's you guys. Thank you. Tell your friends. Tell your family. Get them to listen to the Doctor Is In podcast. Over 4 million downloads and counting. Thank you, guys. Leave us a review. We appreciate it. Okay? If it's good. Give us a thumbs up, guys. We love you dearly. We'll talk to you soon.